Hi, I'm Dr. Joseph Witt-Doering, and the purpose of today's video is to talk about what you need to know if you have a loved one who has dementia and they're being prescribed an antipsychotic medication. So, usually as dementia progresses, it can lead to symptoms such as sometimes agitation and irritability. Sometimes as these patients become more confused, they may not recognize family members, they may lash out at them. Sometimes they may refuse care. And these behaviors, as they become increasingly difficult, usually lead to these older patients with dementia coming into the hospital. At that time, it's not uncommon for them to be prescribed an antipsychotic medication to help with some of the agitation. So really there is one key thing that you should keep in mind if you are caring for someone who is being prescribed one of these medications. And that is that antipsychotics increase the risk of death when they're used to treat agitation in dementia on a long-term basis. So usually the agitation in dementia can come and go. You know, they may have a bad day and then they may have, 3 weeks, a month where they're doing fine. And so if that sounds like your loved one, you may want to ask the doctor to put them on as needed or PRN dosing schedules of their antipsychotic medication. So that way you have it and you can use it when you need it, and they're not going to be at risk of that terrible side effect, increased risk of death. However, what usually happens in progressive dementia is that as it worsens in a subset of patients, they will become persistently more aggressive and more difficult to care for. And in those patients, they usually end up on scheduled antipsychotics, except at that point, it really is, honestly, it may be the best thing that you can do for them. If they're getting to a point where no one can really care for them, it's probably better for them to be on a long-term medication that controls this agitation and allows loved ones to care for them longer. So I hope that helps. That's the one thing that I think you should keep in mind when you're looking after an elderly person with dementia who's being prescribed an antipsychotic. So thanks.